All right, good morning. As you may or may not know, I'm not really good at recording myself. So for my students today, they're going to be taking a preliminary impression before a crown prep, and then they're going to make temps. So let's go over a preliminary impression first, okay? You're going to need a patient, not the stone model, but you're going to need an actual patient. So that's what we're going to say this is. We have an upper and a lower. We have our alginate. We have our water. Yes, you can use Blue Moose bite registration, or you could use heavy body, but we don't want to run out material, so we're going to use alginate. In this cupboard here is all our guns, and our triple trays are up here as well, okay? So you have to have a triple tray to take a preliminary impression. If you forget the preliminary impression, you have to use prefabbed and end up making it on your own. Okay, so what the goal is this is a triple tray. If they bite back here on this, retake it. If you don't, it is going to mess with the occlusion. Now, this stick always goes out of the mouth, and of course, you don't want it this way because you would choke them. Okay, so this goes in the back, right? So once we get it filled with material, I'm trying it on, and I will have the patient in their normal bite together. But you do want them to make sure that they don't bite on that back part. Okay, so here we go. We need a bowl, we need a spatula. Now normally you'd be doing this in an op. Okay. I have 1.5 scoops. I know that's a little awkward because it's 1-to-1 ratio, but I don't want to waste it again. And doctors don't like it when you waste material. So it's been a bit. So I'm going to do 1.5 and try my water the best I can. I'm going to leave this open in case I need to add some more. Okay. So I'm simply going to put my water in and mix like I taught my students. Okay. So once you get a nice mixture, and you don't want it too runny. Thicker is better than thinner, honestly. Okay, so I am going to add a little more powder. And you wouldn't do this in an office. You make sure you have your ratio right, okay? We're going to mix just like I taught them to mix, right? So they've already passed off on alginates, pouring up stone. We're actually at the end of the year. So what you want to do is you want to place it on both sides. And you do want it a little beefy, okay? You want to make sure you get their bite. About like that. Okay? So then you're going to have your patient open, right? I'm going to place it. It's different on a model. And then you have one shot at this, okay? So I'm going to tell them to bite. Okay? You want them to hold that bite. So at this point, you don't want to ask questions to your patient or anything like that because you don't want them to nod. You don't want them to move. You don't want it to get a blurred image. Okay. So at this point, while the patient's biting and I'm waiting for that to set up, I could clean. Or I gotta change my gloves. There's many things that I could be doing right now. I could organize my tray. I could make sure my anesthetic's set up, make sure my shade guide's ready, all that. Okay. So mine was on the little runny side. So it's going to take a minute to set up. See if we can see it right there. I hate to be bumpy. Guess that I don't record really well. Okay. And then don't forget, this sets up really quick. So you want a wet paper towel, okay? But we are not going to pour this up in stone. This is actually going to be our impression. Not yet. You can't rush perfection. That's getting there. All right, okay. Just got suction cup there. So patients think they can't open, but it's all up to them, okay? So now I'm gonna have my patient, I'm gonna tell them to open gently. Oh, I forgot to place Vaseline. All right, guys, my bad. So whenever you work on stone, you have to place Vaseline, okay? So mine got stuck a little bit, which I'm not surprised. And I'll get this back here for us too. Okay. And then just have them open gently. Okay. All right. So yeah, unfortunately mine's coming out a little bit because I didn't use Vaseline, but it is really a good impression. So if I was doing that tooth number 30, I would be good to go. I've got the bite on the bottom, so wrap it in a wet paper towel and put it in a sandwich bag, okay? You'd put your patient's name on it, but you guys are going to put your name on it, all right? And that's what we're doing today.